I call the member for Albury.
Thank you, Speaker. Speaker, as part of ongoing advocacy for health in our community, I made representation to the New South Wales Health Minister in early April this year, raising physical infrastructure as planning continues for the $558 million Albury campus redevelopment. I also addressed the critical issue of digital infrastructure, drawing attention to the fact that Albury-Wodonga Health remains without an electronic medical record system. Electronic medical record systems centralise a range of information such as medication management, pharmacy, oncology, palliative care and fluid management. An integral part of the e-health strategy for New South Wales Health 2016 to 2026, the EMR digital system is now available at over 187 New South Wales health sites funded by the former coalition government. The rollout of the EMR Connect program has made it easier for medical professionals across New South Wales to access a patient's complete medical records. Statistics show over 23,000 New South Wales clinicians are using EMR at any one time. Disappointingly, this important program does not cover Albury-Wodonga Health, which as a cross-border health service is managed by Victoria. I have been advocating for improvement of digital capability at Albury-Wodonga Health for several years to enhance the quality of patient care and improve health outcomes. In December 2021, I flagged my concerns about the ongoing use of paper-based forms and documents at Albury-Wodonga Health to the then Minister for Health, raising that another important piece of digital infrastructure, the patient administration system in use at our two hospital campuses, operated on two separate databases. In response from the then Regional Health Minister Bronnie Taylor, the Minister shared her belief that a single PAS system for Albury-Wodonga Health would reduce clinical risk, increase efficiency and enable the health service to meet its New South Wales and Victorian reporting requirements. The project for a single PAS has not been without challenges, but I understand it is moving closer to implementation. I further raised digital capability with the Victorian Health Minister in a meeting in July 2022. At the time, the Minister acknowledged work being carried out on a health information exchange, contingent on the passage of legislation in Victoria, to amend the Victorian Health Services Act 1988. This would enable a centralised electronic system to allow public hospitals and health services to share specified patient health information to provide medical treatment to patients. The Health Legislation Amendment Information Sharing Act 2023 in Victoria came into effect on 7 February this year, enabling the establishment of the new system. It is important that Albury-Wodonga Health benefits from this integrated system. Speaking at the Albury-Wodonga Health Annual General Meeting on December 12, 2023, Board Chair Jonathan Green told the gathering, "Our staff have called for targeted investment in our infrastructure and our digital systems. When compared to our metropolitan colleagues, our digital maturity is trending downwards, whilst city hospitals continue to trend upwards. Increasingly, contemporary practice relies on electronic medical records to enhance clinical safety, and more investment is needed to bring Albury-Wodonga Health in line with best practice." In a research paper released last week by the Productivity Commission called Leveraging Digital Technology in Healthcare, it revealed the introduction of an EMR and alert system in a public hospital reduced overall pathology tests by 6.3% and imaging by 12.5%. Researchers also revealed the introduction of an in-hospital EMR system would shorten stays in both admitted and emergency care. The report details, this is a result of improved clinician workflow, as delays in accessing patient information and test results from paper records are minimised, allowing for faster decision-making and patient flow. We assume that the magnitude of these effects are a 22% reduction in the emergency department length of stay and a 6% reduction in admitted care length of stay. In response to my latest representations in April, the New South Wales Health Minister stated that while Victoria manages the EMR system, we welcome the opportunity to continue discussions with the Victorian Department of Health on information sharing to support patient care and improved health outcomes for people who live in the border region. I thank the clinicians who have raised this issue with me. I also acknowledge the Health Minister for his response, and I will continue to urge both state governments to work together to address this issue. The expert evidence of the Productivity Commission is clear that the uptake of a coordinated EMR system within Albury-Wodonga Health would be hugely beneficial for both patients and our dedicated healthcare workers.